Welcome to Legal 123s with ByrdAdatto. Legal issues simplified through real client stories and real-world experiences. Creating simplicity in 3, 2, 1.
Well, welcome back to another episode of the Legal 123s with ByrdAdatto. I'm your host, ByrdAdatto, with my co-host, Michael Byrd.
As business attorneys for healthcare practices, we meet a lot of interesting people and learn their amazing stories. Brad, this season's theme is the business of medicine today. Gone are the days of grandpa's medical practice with paper charts and old school treatments. We will confront the business and healthcare issues faced by the modern medical practice.
It's exciting, Michael, and I'm actually really excited to bring on our guest today. But before we do, am I the only guy in America who once believed a Twinkie could survive a nuclear fallout?
Well, everyone knows, Brad, that Twinkies don't expire. I think that the expiration listed on the package is just a suggestion.
Okay, I got it. But,
Yeah.
I don't know, Michael, if you remember that dark American history, a time of fear and chaos and pure mayhem. Do you remember that?
I'm not sure. I want to ask, what chaos are you talking about, Brad?
Michael, we're talking about when we all got caught up in the great Twinkie crisis of 2012.
I don't remember anything called the Great Twinkie Crisis, but I do think I know what you're talking about.
Yes. For those who don't know, the Twinkie apocalypse happened in November of 2012 when Hostess announced it was shutting down because of a nationwide strike. People were here like, no more Twinkies, and suddenly the whole country is stampeding down the grocery stores, and it's like Black Friday meets the Hunger Games as they're trying to get a hold of their Twinkies.
Yeah, I do remember. I actually went and bought Twinkies for my kids to experience, but I got them before things went crazy. It wasn't like I didn't get trampled.
Of course you did.
You're
You're a good planner.
Yeah.
I was out there, elbow deep at the grocery store trying to get the last box of Twinkies. I don't know if you remember this, but people were listing Twinkie boxes on eBay for hundreds of dollars. Someone even put one up for $250,000, $250,000 for something that basically has a shelf life of a small asteroid.
You didn't buy it, did you? The $250,000 package?
No comment.
Okay, yeah. People can get kind of crazy, and I'm looking at you as I say that. You just look at what happened last year with Labubu's. I don't know if that market, I heard, has crashed already.
Yes, luckily I missed the Labubu craze. Before you did ask, I did not buy the $250,000 box of Twinkies. I'm not that dumb. Although, who wouldn't have considered it? They must have been really good for $250,000.
Yeah. No comment, but it does feel like a uniquely American moment for sure.
Sure is, yeah. And for those who don't remember the outcome, don't worry, America. Apollo Global Management swooped in, paid $410 million, bought Twinkies back from the brink of death in 2013. Order restored, snack cake civilization survive, which leads me to the most important legal question to today's show, Michael. Did you ever eat a Twinkie?
Did I ever eat one?
Mm-hmm.
Well, yeah, of course. Yeah, that was a big part of my childhood. I don't know that I've had one in years, but I'm betting they're not as good as I remember them being. But I do appreciate the history lesson, Brad. I'm not sure what Twinkie talk has to do with our show today.
Okay, we're not sure how familiar our guest today is with the great Twinkie apocalypse of 2012, but the Twinkie story kind of made me think about what's happening now in the business of medicine today as it relates to the chaos and mayhem that's happening with non-compliant med spas and wellness clinics and the passion she has for correcting it. So much like Apollo Global Management saving Twinkies, maybe our guest can help save the med spa wellness world.
Yeah. That segue was about as smooth as sandpaper.
Thank you. That's about the best I can get.
Yeah. All right, let's bring our guest on. Let's get to it. We have longtime client and friend of the show, Dr. Kate D, joining us today. A little about Kate. She attended Yale for college and medical school, moved to Seattle for residency at the University of Washington, followed by fellowship in breast imaging at the University of California, San Francisco. She was a breast cancer specialist at Seattle Breast Center for 13 years, receiving top doc honors each year since 2010. After a successful career in this area, Kate found her way to aesthetic medicine. Kate has been part of the West Seattle community for over 25 years and raised her 3 kids there. She is the author of the industry expose, Med Spa Mayhem, has her own podcast, Med Spa Confidential, where Brad's been a guest, and she agreed to come back and talk with you. So you must not have messed up too
bad. I don't
bad
know about that.
Kate especially loves to ski, cycle, hike, and cook. Kate, we're so glad you're here. Thanks for joining us.
Awesome.
Sorry, I had a little freeze there. I really appreciate being on. I would love to tell you that I experienced the Twinkie apocalypse. I do remember that event though. And I remember learning that Twinkies were extruded rather than baked. That's all I remember from that time.
Oh.
Like they're not even a baked good.
So
that's all I know about Twinkies.
So if you know a lot more than I do now already. So even though I've eaten them, so have you ever eaten a Twinkie then?
I believe I ate one Twinkie when I was 15 because my high school best friend was like, "I can't believe you haven't eaten a Twinkie." But I was kind of more of a ring ding fan, so
Yeah, those were quite solid as well.
Yeah, I remember those.
Yeah. Well, cool. Well, let's get in. I have love actually just to start with having you introduce yourself to the audience for those that don't know you, and talk a little bit about yourself and anything that I didn't cover in my introduction.
Yeah, well, thanks so much. I got into aesthetics a little over 12 years ago now, opened my own med spa back then. And at the time, I didn't realize how the med spa world was pretty much in its infancy still. It had only been around for maybe 10 years at most at that time. And you guys have known me a long time. I'm pretty much a stickler for being, an expert in what I do. And also I have this thing about medical legal. I have a medical legal interest. It's always been really interesting to me. So I really figured out like how to do this properly. And I thought I was doing everything right. And when I met you guys, you helped me make sure that that was true. And in the 12 years since I've been in this industry, the industry itself has exploded. So it's become, well over $20 billion industry, which to put that in perspective is, as big or bigger than the NFL. Okay. And in that time, most of that growth, in my estimation, has been people doing things illegally one way or another, or in lots and lots of ways. And over the years, I've met more and more people in the industry who we all know it's happening. We all kind of are dumbfounded by how many people are getting away with doing these illegal things. And everybody's kind of throwing up their hands like, what do I do? And people are afraid to report about it because they're afraid of being retaliated against. And it's really a mess in a lot of ways. And the mess has just been getting bigger. And if you just look at the recent arrests and studies that have come out of New York and Florida, if you look at the data from those studies, 60% of med spas in those studies have been shown to be illegal. And I don't even think that they're measuring some things like corporate practice of medicine violations. I don't even think they're looking at that. And so I just thought, well, I just couldn't believe it was going on. And I started writing about it. I wrote the book, Med Spa Mayhem. And I thought, okay, I'm just going to publish this book, get it out of my system. And that's going to be the end of this for me. I'm just going to be done. And then what happened was the opposite. Was part of getting the book published, I started the podcast and I started interviewing people from all over the country who had very similar concerns. And they told more and more stories that I didn't even know before. And out of that, the whole last 2 years, many of those people had basically said, yeah, I'll help you and try to do something about this. And the Medspa Board was born out of that. So there are 8 of us who are actually organizing it. I would say, 4 of us are sort of actively really, really working on getting this launched. And we have a little medical advisory board. But basically, we looked at what's happening. And And if you look at the laws that are being proposed all over the country in different states, they're all trying to put more regulations on medicine that we really do have a lot of laws already. And I think what's missing is enforcement. I think that there's really no enforcement until someone's very hurt. And even then, a lot of people are afraid to come forward. A lot of victims are afraid to come forward because they're super embarrassed about having gone to these places in the first place.
Mm.
So the irony here is that like that approach of putting more laws on it only has an effect if people are willingly compliant with the laws. And we've already seen that there's people all over the country, you know, if it's a $20 billion, that's probably like $12 billion that are going to illegal, operations. So I wanted to change it upside down. I wanted it to be more of a, if you're already operating legally compliant, manner, then join the Med Spa Board. We are solving the problem that every single legit med spa encounters, and that is how to compete against all these illegal operations in your neighborhood. And so this is how you do it. We create a Med Spa Board where we have a national set of standards that are really basic that every single med spa should comply with. And the people who are already doing it legitimately, all they have to do is apply, show that they're already legit, and um, be able to be called Med Spa Board certified. And we have digital assets for their website and social media and advertising. We have a certification, a certificate that they can display in their window. Um, and then we have a national directory that's growing actively. And we're going to be focused on uh, growing the business of all the certified spas. And so it's a really easy way to differentiate your legit spa from all the, competitors that are cutting corners.
Well, and this is great information, especially since our theme is the business of medicine today. And as you were talking about the Med Spa Board that you've helped organize, you were talking about different action items. And I want the audience members to be clear. You were talking about enforcement and other things. Is the Med Spa Board, tell me like if they, what are they trying to solve and what are they actually doing?
Right. Well, so the problem is that there's no way to differentiate. If you're a patient or a prospective patient looking for a really great aesthetics provider near you, there's no way to differentiate the legitimate legal ones from the illegal ones. I've had, lawyers come to my spa and tell me they couldn't tell the difference between my place and an illegal one in the general neighborhood, right?
Well, they're
Because it's
not
just
very
not
good lawyers,
obvious.
is what I'm hearing.
Very smart, but not in the area of healthcare law or med spa law.
Yeah.
And so for those of us who are legally compliant, we really care about patient care. We're, a high-end practice. We're ethical. We're owned legally. We use real products. It is really hard for us to differentiate ourselves from everybody else. And so it's a voluntary certification that allows you to advertise, hey, we're certified by the Med Spa Board. And so that, you know, assuming a critical mass of spas get certified and this emblem becomes recognizable to the public, kind of like, certified organic, you know what that means, right?
Mhm.
Right now, we're new and we're trying to get the word out. Like, what does it mean? I think so many people just have no idea how illegal these places are. They just don't know. And so they walk into a place, someone's in scrubs, they don't even ask what their licensure is. They just assume they're medically licensed. They pay money. I mean, even if they're happy, it doesn't mean that the entire thing wasn't like completely illegal. Um, and and the fact is that those places cutting corners make it really, really difficult for the legitimate medical practices to compete because they have much lower costs if they're not paying for legitimate product, they're not paying for a medical director or a doctor to supervise them. Um, so this is a way of differentiation, and it's a way to advertise and market your spa as legit. And it's really hard to do that when, what are you going to say, like, hey, I'm a doctor, that other place down there doesn't have a doctor anywhere near it, or it's really impossible to make that statement. It's very difficult. So, and I think that any place that's already practicing legitimately, the process of getting certified is very, very simple, because you just fill out an application. It takes less than 15 minutes to fill out. And we make sure everybody's license is valid in the state where they are. We look at their NPI number, and we do all that assessment. And we actually interview the medical director as well. So places where they don't have a legitimate medical director, either they won't apply because they know their medical director won't be able to do this, or we'll find out in that interview. Because if one of the things that many states are doing, including, as far as I know, Michigan, and the new laws that are proposed in Indiana and Massachusetts. One of the things is focusing on a legitimate medical director, and in this case, right, you really have to have a medical director who understands aesthetics, who can perform those procedures, who can supervise somebody who is being delegated to do those procedures. And you need to have some kind of presence in the spa. You need to know your employees. You need to know their practices. You need to be able to supervise that. And right now, many of these spas have what I have always called fake medical directors, but you can just call them absentee medical directors, where, it's a doctor somewhere. They have a medical license, but they don't actually know anything about aesthetics. They're never in the spa. They don't do anything. And actually, if you look at the recent backlash in New Jersey, right,
Mm-hmm.
where there's nurse practitioners who are temporarily allowed to practice independently due to COVID, that was rolled back. And now they have to have an actual supervising physician. They're all angry about that, right? Because they do not want to pay money to a doctor for, quote, doing nothing. And I think that that's a very prevalent attitude of, like, well, we don't need that. It's required by law, but it's stupid. And why should they get paid money for doing nothing? And I would argue they shouldn't be paid money for doing nothing. They should be actually doing their job of being a medical director.
Well, that's a great point.
Yeah, if I'm reading between the lines a little bit, and just knowing you, it feels like kind of the foundation behind all of this is a concern and commitment for patient safety. Talk a little bit about that and your passions in that area.
Yeah, well, 100%. I mean, you know, it should be a safe space to walk into any medical office. And the practice of aesthetic medicine is the practice of medicine. And anything could happen. Just because this is cash pay and elective doesn't mean it's not a serious medical procedure. And there are a lot of procedures that get done in med spas that have very big potential consequences. Not just a droopy eyelid, which is not desirable, but luckily goes away, right?
Hmm.
But complications like burns and infection, um, and and you know more than that, I know that this sounds like overblown, but death. There are people who have died at
Yeah.
med spas. Um, and you have to have medical personnel who understand, not just the substance, whatever medical drug or device is being put into the patient, but also the anatomy of where they're putting their needle, and how to manage any negative consequences that happen once that procedure is done. And a lot of med spas are just not prepared with any of that stuff. And I can tell you that, as a former recovering radiologist, right? We are very, very anatomy intensive in radiology. Same with surgeons. Okay. But there are actually a lot of other doctors where, although we study anatomy in med school, if you're not touching the face with needles, you're not going to know the intricate anatomy of that. And that's doctors. Like, the lower down you go on the hierarchy, which, it is a hierarchy, unfortunately, whatever. Um, there's less and less education there. And I can't tell you how many people go to a weekend course to learn how to inject things in the face and then put up a shingle and start charging money to do that. And these are not people who've had years and years of training in anatomy and physiology and then medicine and how to manage complications. So those weekend courses, in my opinion, should be completely not. I don't know. I find that very, very dangerous. So there are so many ways that patients could be harmed walking into a med spa, and I don't think that people are aware of the risks.
So kind of following the bouncing ball, if the spirit of all of this is patient safety, and then the problem is there's vast non-compliance, that there's this, whether whatever the motive, there's non-compliance, and your point earlier is there's a lot of laws already governing the practice of medicine, and so the solution might not be passing new laws that are just written on top of the other laws that already are in existence. And you kind of pointed to there's a lack of enforcement that's happening, but it seems like you're kind of taking the ball to help move the ball forward, is grounded in this Medspa Board of like, okay, well, let's showcase the people that are doing it the right way. Is that kind of the
Yeah,
track?
absolutely. And so a lot of it is patient education. And if you showcase or promote all the really high end, ethical, legal, safe practices, right? Hopefully over time, a critical number of consumers will understand the difference and hopefully abandon, or most of them will abandon the illegal ones. Like, well, there'll always be people who seek out an illegal option because it's cheaper. So there will be people who fly to Mexico because a cosmetic procedure will be cheaper there. But they know they're making that decision. They're making that, knowing that medical laws are different in other countries, right? And they're taking a risk. I think that over time, people in this country, most of whom, I would say most consumers, really care about their own safety, and having a high quality, safe procedure that makes them look better, that doesn't risk permanently scarring them. Okay. Um, I think they really want to know. And so ideally what happens is the legal, legit, safe places get labeled and promoted and advertised as such. And the consumers become aware of this and make that choice. And I think over time, the illegal places will stick out like a sore thumb because they won't be certified, and people will hopefully abandon the dangerous
So if
practices.
you had your crystal ball following that logic, where do you think that tipping point will be where the places that have the certifications will be the norm and the ones that don't would be the exception?
Right. How long do you think that this will take? I I really think that it will really depend on how how we get noticed.
Hmm.
I have a friend and colleague who is shopping this whole idea as a movie. He thinks that the book, not just the book, but like the entire thing would be a really great docudrama. So if anyone is listening to this who works for Netflix, please, take our phone calls. But I really do think that if we get, a celebrity to tweet about it, it will become really well known much more quickly. But otherwise, I'm really trying to get all of, basically your audience, my audience for my podcast, to get certified and to join us. It's not an expensive thing. I am not looking for this to like be making a lot of money. I really want this to succeed in order to change the industry to be safer. Um, I do hope that, this year, as we try to reach out to as many people as possible, as many providers as possible, that they'll see the value in it, and they'll voluntarily get certified and advertise it and tell all their friends. I think in the truth, it's a teeny tiny drop in the bucket of your marketing budget. So if you look at the marketing budgets of med spas, those are enormous. And the idea of, paying for this is a teeny tiny amount of money. So I'm kind of hoping people see the value in that. But I think, to answer that question, like, the elevator pitch is, how do you win against your illegal competitors? We help you do that.
Yeah. Well, and to your point with first off, the Netflix show, if they do cast it, I'll be happy to be the star of it. But second, it reminds
Well,
me
I
of,
think, Brad Pitt should play
obviously,
Brad.
yeah, I was just about to say that. But John Oliver, did that, I'll call it my words, like, review of med spas, and I know it did not put med spas in a good light. And your reaction is the opposite, which is, well, yeah, there's some people out there doing things, in an incorrect way, but your idea is to kind of reshape the mold as to how a compliant med spa looks and acts from that perspective. And I know, Michael, we've probably got time for about a quick question.
We'll do final question, quick round. So I'd love to hear just what are you optimistic about for the medical spa industry as you kind of look forward? You're trying to solve a lot of problems, but I'd love to hear.
Right. Well, see, I think the med spa industry is fantastic. I mean, I've been in it for 12 years. I think we do really great work. And most of us are, safe and effective. And people love it. I mean, that's why it's growing so much. So I'm very optimistic that, I think the industry is still growing. I do think, though, we need to take a beat and self-regulate, because what's happening now is that all these states are looking at trying to make it more onerous to be a med spa, when in fact, really what we should be doing is enforcing existing law. So I'm just hoping to be able to elevate the industry, elevate the legit spas, and help them thrive.
Love it. Well, thank you so much for joining us on the Legal 1-2-3s with ByrdAdatto. We're grateful for you, and we'll go to break. And after we come back, Brad and I'll have a quick little legal wrap up. Thank you.
Thanks so much for having me.
Many business owners use legal counsel as a last resort rather than as a proactive tool that can further their success. Why? For most, it's the fear of unknown legal costs. ByrdAdatto's Access Plus program makes it possible for you to get the ongoing legal assistance you need for one predictable monthly fee. That gives you unlimited phone and email access to the legal team, so you can receive feedback on legal concerns as they arise. Access Plus, a smarter, simpler way to access legal services. Find out more. Visit ByrdAdatto.com today.
Well, welcome back to Legal 1-2-3s with ByrdAdatto. I'm your host, ByrdAdatto. I'm still with my co-host, Michael Byrd. Now, Michael, for those who don't remember this season, our theme is the practice of medicine today. And we just had an amazing conversation with Kate, very passionate about compliance, about patient safety, founding the Med Spa Board. And what I thought was interesting was she was talking about all these states with new laws, but in reality, a lot of states already have the laws in place that they could enforce. They don't actually need new laws.
Yeah, I mean, it just creates more, and many times more, confusion when you put a law on top of an already existing law. And there's the thought, okay, well, we'll just enforce the laws that are in place rather than write new laws. And one of the things we've observed over the years is that there's a lack of understanding from the regulatory bodies on the laws that they're enforcing. And so we see enforcement be very uneducated, I guess you would say, in their approach. And sometimes they're attacking the wrong things, and sometimes they're not attacking things they should be attacking. And so I do love that she's trying to come up with a solution around these two problems.
Absolutely. I like it. All carrot is something I think she said at one point. But audience members, believe it or not, that's all the time we have today. But we'll be back next Wednesday. And in this one, it is going to be a fan favorite as we close out this season. And it's the preventable death to your practice, which kind of rolls right into what we just discussed with Kate. Thanks again for joining us today. And remember, if you like this episode, please subscribe. Make sure to give us a 5-star rating and share with your friends.
You can also sign up for the ByrdAdatto newsletter by going to our website at ByrdAdatto.com.
ByrdAdatto is providing this podcast as a public service. This podcast is for educational purposes only. This podcast does not constitute legal advice, nor does it establish an attorney-client relationship. Reference to any specific product or entity does not constitute an endorsement or recommendation by ByrdAdatto. The views expressed by guests are their own, and their appearance on the program does not imply an endorsement of them or any entity they represent. Please consult with an attorney on your legal issues.